Most people think OCD just means you like things perfectly clean and organized. They are actually very wrong. If you've ever casually joked, "I'm so OCD about my desk," you really need to hear this. Real obsessive-compulsive disorder isn't a quirky personality trait. It is a serious medical condition that can secretly take over a person's entire life. By the end of this video, you'll know exactly what it looks like and how to get help. Let me explain what's actually going on. OCD is a chronic mental health disorder that usually begins during puberty or early adulthood. It is characterized by two distinct but connected problems: obsessions and compulsions. First, let's talk about obsessions. These aren't just your everyday worries. They are relentless, intrusive thoughts that cause severe anxiety and distress. The person knows these thoughts are completely unreasonable, but logic simply cannot make them stop. Common obsessions include an intense fear of contamination, an overwhelming need for symmetry, or terrifying thoughts that a loved one will be harmed. It feels exactly like your brain is sounding a loud, false alarm that you just can't turn off. To quiet that unbearable false alarm, the brain turns to compulsions. These are repetitive physical behaviors or mental acts performed strictly to relieve the intense anxiety and disgust brought on by those obsessive thoughts. You might see excessive hand washing, repeatedly checking if the front door is locked, or seeking constant reassurance. Often, these compulsions take up at least an hour every single day, completely disrupting a person's work, school, and personal relationships. Here's what most people don't realize. People with OCD do not enjoy these routines. They feel trapped. If they try to stop the ritual, they quickly feel remorseful and terrified that something disastrous will happen to someone they care about if they don't finish it. So why does this happen? We don't have one exact cause. Medical research shows it has genetic components, meaning it can run in families. But it's also strongly linked to physical trauma or emotional neglect experienced during childhood. Severe stress-inducing events like bullying, bereavement, or even childbirth can also trigger the onset of OCD. Interestingly, highly methodical individuals who hold themselves to extremely meticulous, high personal standards are actually more likely to develop these symptoms. It's also important to know that this condition rarely travels alone. Many patients I see at the clinic who struggle with OCD are simultaneously battling other mental health challenges, such as anxiety, panic disorders, depression, or even addiction. Now that you understand the mechanics, what can you do if you are suffering? The first crucial step is awareness. You must try to recognize that the intrusive thought is just your brain misfiring. It is trying to control you, and you must consciously challenge it. Simply take a pause when the thought comes up rather than immediately responding to the urge to perform your ritual. I know it's incredibly hard to resist, but over time, practicing this puts space between you and your thoughts, helping you view them objectively. While you take that pause, use a distractor technique. Do a household chore that demands your full attention, or go talk to your friends or family members. Breaking that immediate cycle of anxiety is a huge victory for your brain. You don't have to fight this alone. Medical treatments are highly effective. We often use cognitive behavioral therapy, specifically exposure therapy. This gradually exposes you to your triggers while helping you slowly reduce your compulsions. It takes time, but it works. Doctors can also prescribe antidepressant or anti-anxiety medications to ease your symptoms. Combine this with anxiety management techniques like deep breathing, getting adequate sleep, and regular physical exercise. Taking care of your emotional health is key to avoiding feeling overwhelmed. Remember, this video is for educational purposes only. If you or a loved one are struggling with OCD symptoms, please consult your doctor or visit our doctors at Klinik Temasya for personalized advice. If you have questions, leave them in the comments, share this video, and check out our video on managing anxiety.